In 2017, the ADA released that position statement that we should be screening children for sleep-disordered breathing and assessing more than just teeth. A lot of people that are in this space and have learned more, there's a personal side to it. I never looked at how they were just sitting in my chair, all of them waiting for an exam with their mouths open. We would see patients who had seen the orthodontist for a few phases of ortho, and they'd go back in again at 16 because their open bite reopened.
Yep.
Why is that? We're not airway doctors, like we don't treat the airway, but we're helping things that could help the airway secondarily. Right. We started adding the PSQ, so that's something that people could start doing right away, just adding that in. I'm a big believer now in body work, whereas if you talked to me about a chiropractor 15 years ago, I would have kind of rolled my eyes and laughed. And now I completely think that a lot of kids need this, and I've seen changes with babies. I think just working collaboratively with other providers, we can get really good changes and get better quality of life for these kids. When the child sleeps better, the whole family's happier.
Yep.
If they're really narrow, like these little 21 millimeter pallets that come in, if I go in and release a tongue tie, where will that tongue live? I have the therapist actually fill out a form saying functionally this patient is ready for a release. So I will not do it unless I have that in my chart, and then they know that they have to follow up with the therapist afterwards as well. If I'm newly working with a provider, I'll have them come in like a week or two before the release to make sure that they're good. If you look at all of these extra things, and if we could do a little myofunctional therapy, or if they have allergies, then as an orthodontist, you will have better outcomes in stable cases, right?
Yes.
And patients that aren't coming back 2 years later, like, why is this moving, or why is this like this? When you put in the work a little bit more at the beginning, then you'll be happier and patients will be happier later on. I wish I knew the things I know now with my son. I was in the corner of my kitchen crying because I couldn't breastfeed him. And nobody mentioned anything. Fight for your child. Be proactive. Don't just wait till things get bad into where you have to do all these things. You can maybe start when things are, let's say, stage 1. You know, we have just a little mouth breathing, and just correct that. And the earlier you start, usually the interventions aren't as intense. If you're listening to this today, it's for a reason. As a provider, you can go change lives. As a parent, you can do something more for your child. If you want to do something, you can do it, and nothing is impossible.